I don't think that, you know, the barriers to entry to doing this work are not that you don't start early. The barriers are right now, there's just not a lot of trainings and not a lot of substances that are legal to use. And they're not being, the ones like ketamine are not being used in that many places. That'll change. But I think if you're a good therapist, you'll be able to just go to a training and find those avenues. What most clinics and most, people like myself who run clinics, I'm scouring, I'm looking for good therapists, right? So what you want is, it's the skill is what matters. It's not what they've done on paper. It's like, do they know what to do when they're in the room, right? And are they able to hold this work the right way for the client and so on. So, yeah, honestly, I wouldn't. So I think what you're asking is like what you do in a career development way. And I'm not really answering that, because what I'm answering is like, you get really good at being in the room with a person and like knowing where to go. You just get to be a really, really good therapist and then go do this. So,
Yeah.
yeah,
Yeah.
be a good therapist first, and then you can get trained in psychedelics. I mean, I guess you could theoretically do it in parallel, but I would hesitate to put anyone in who comes to my clinic with an early career therapist. I don't think I would do it, because I feel a sense of responsibility for. Now, if it's a training context and a training clinic and the clients understand that the person is training, then yes, 100%. That's a different contract, right?
Yeah.
Yeah. But, and there's no reason. I mean, obviously, people have to train somewhere, and there have to be clients that are helping with that.